I know that changing information can be confusing, and it means staying attuned to the latest updates. I ask each of you to be careful about where you get your information and to rely on trusted, local, and timely sources. If you have questions, please don't go to social media for looking for answers. The World Health Organization, the Public Health Agency of Canada are trusted and reliable sources. Or visit our provincial website at gov.nl.ca/COVID-19 or your local health authority's website to find reliable and up-to-date information to help you and your family make the best decisions. This brings us to our expectations around Christmas. I caution against planning any extensive functions or gatherings at this time, except for those with your close contacts. We simply don't know where we will be in the next few weeks. So I continue to hear of workplace Christmas parties being organized, which is concerning for me. As I've said before, this is just 1 year and things will have to be different. We need to find new and creative ways to celebrate the holidays without parties. When this pandemic is behind us, and that day will come, you can put your party hats back on. We just need to hold out for a little bit longer. We need to find resolve to keep fighting the fight and adhering to our tried and true public health guidance. Keep your households close, consistent contacts to 20 or less. Maintain physical distancing. Stay home if you are unwell and call 811 if you have any symptoms of COVID-19. Wash your hands frequently and effectively. For many, the holiday season is one of joy and celebration. For others, especially those with existing mental health concerns or individuals who feel isolated, Christmas can amplify sadness and depression, even more so this year with the pandemic. So if you need support, please reach out for help. We have many resources available, such as our provincial mental health crisis line, the Channel Warm line. You can also visit Bridge the Gap and the Department of Health and Community Services website to find a range of options of support with mental health for those with mental health concerns. If you know someone who may be feeling alone this Christmas, please consider ways of safely connecting with them over the holiday season. We will also need help from our communities to find ways of supporting anyone who is feeling isolated this Christmas. I'd like to turn our attention now to the new travel form, which went live on Tuesday. All essential travel to Newfoundland and Labrador requires the completion of this form. It can be submitted online up to 30 days prior to travel. All travelers need to complete this form. This includes Newfoundland and Labrador residents returning to the province, rotational workers, and essential workers. If you have already received a travel exemption for your upcoming travel, the exemption remains valid, but you still need to complete the travel form to ensure smooth entry into the province. Once the form is completed, travelers will instantly receive an email with a reference number, and this is the number that they will be required to present to border officials upon arrival to the province. As a recap, for those who may have just joined, we have 1 new case since yesterday's media advisory, and the total number of cases in our province is 340. I've seen firsthand the lengths that Newfoundlanders and Labradorians will go to protect and support one another. It's what we are known for. So now is the time for us to show the solidarity and kindness that characterize our province. Hold fast, Newfoundland and Labrador. Thank you.
Thank you, Dr. Fitzgerald. The core message for how to safely navigate the Christmas season is certainly clear. 2020 is not going to look like other years, as much as we wish it would. With everyone following public health guidelines, the rules of self-isolation and holding smaller COVID-safe gatherings, we can handle the spread of COVID-19 in our communities. I'd like to take a moment to speak directly to everyone living in long-term care facilities across our province. I recognize that COVID-19 restrictions have been especially difficult on you and your families. Cut off from seeing your families and friends in person for a while, and perhaps now even worrying more than ever that we'll be back there again before Christmas. You've worked hard throughout your lives, enriching the very fabric of Newfoundland and Labrador. And now you may feel vulnerable, worried about what would happen if, God forbid, you yourself got COVID-19. You are the ones we are all so focused on protecting. We want to ensure that you can still see your families. We want to keep this province as safe as possible so you don't have to live in fear. Thank you for your patience. Thank you for your resilience. Thank you for being flexible. Many of you have become pros at video calls and using tablets when you may have had little use for them before this pandemic began. I hope that you continue to stay connected to loved ones and know how much we all care about your well-being. Thanks as well to all of you working in the long-term care facilities to make each day as comfortable as possible for those in your care, despite the uncertainty and the pandemic. So stay safe, Newfoundland and Labrador. Take care of yourselves and each other. And with that, I'll turn it over to Dr. Haggie.
Thank you. Thank you very much, Premier. It is day 270, and we have 30 active cases in the province, a slight drop. They seem to be plateauing in the numbers over the last few days, which is an encouraging sign. We are where we are because, by and large, Newfoundlanders and Labradorians have been very responsible and responsive to the changing requirements of public health throughout this pandemic. Individuals have listened and followed guidance. Businesses have done the same. And again, speaking this weekend, Black Friday in my own district, the big box stores there were very responsible, counting people in and making sure that people observe physical distancing and altering their checkout routines to allow for better spacing. Bars and restaurants are really keen to make the best of the situation here and not jeopardize their business and anyone's health, and I take my hat off to them. With a combination, however, of fatigue about pandemic and forgetfulness, we all have lapses, and I think we have to acknowledge that as human beings. We will never be totally perfect. I am aware, however, of parties being suggested for the new year, and on the tickets, virtually, it says, don't bring your cell phone, no photos allowed. And what I would suggest for the people who are seriously thinking of going to those, you are actually putting yourself in harm's way. There is no conceivable reason why a legitimate establishment would want you to not take a phone or not take photographs unless they're worried about the repercussions of what you might see and record on social media. We are much better than that, and you'll go home from a place like that with more than a hangover if you're not careful. From the point of view of those people who post on social media and are worried about maybe violations or transgressions of individuals, there is a complaints form on our website, and those complaints are looked at on a regular basis and triaged depending on their nature. If it's around individuals and their behavior, then that will go through to local law enforcement, be it the Royal Newfoundland Constabulary or the RCMP, depending on the area of jurisdiction. If it's a business, then it could go to Service NL, who have two responsibilities predominantly, one through environmental health officers and the other through occupational health and safety. And the third stream would be for licensed establishments where the Newfoundland and Labrador Liquor Corporation have jurisdiction there. We have, between Service NL and the NLC, proposal to pair up environmental health officers and liquor inspectors to be able to provide a rapid response should there be indications of a licensed establishment having some difficulties in following the rules. And I have to take my hat off to both NLC and Sean Lyle's team, as well as Minister Stoodley and Service NL, and now Minister Byrne, who is responsible for it, for their responsiveness in dealing with complaints in that area. On the subject of forms, Dr. Fitzgerald has mentioned the travel forms. They are a one-stop shop now for any arrival in the province. For those individuals who would be seeking a travel exemption, they can also get that through using this form. And for simple cases where the criteria are very clearly met, that reply and the approval of that exemption can be virtually instantaneous. It will come back, as Dr. Fitzgerald says, with a reference number which needs to be quoted at the point of entry, at the time of entry. You can apply anytime up to 30 days in advance. you can even apply as you leave to the airport, although in case of travel exemptions, if there are some queries, this may produce a delay at the airport. We have, in the first 24 hours of going to this form, just over 1,500 forms completed online, and the system has worked extremely well. And again, thanks to the IT support that we've had to enable that to happen seamlessly. On the base of IT comments, I think I would also like simply to reiterate Dr. Fitzgerald's comments. The information as to how to manage COVID, what responses are appropriate, the state of research in peer-reviewed and trusted articles is out there through the sites that Dr. Fitzgerald has mentioned. YouTube may not be your best place to get peer-reviewed science just at the moment, and I would caution people about folk who may be making claims that cannot be substantiated. So with that, Premier, again, just to congratulate Newfoundlanders and Labradorians for the hard work they have done. Keep the faith, hold the line, and I'll turn it back to you now, Premier.
Well, thank you, Minister. We'll open it up now for questions from the media.
Thank you, Premier. For the benefit of our speakers, there are 5 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have any final questions. Our first questions are from Peter Cowan with CBC. Please go ahead.
Mr. Hagee, you mentioned there the reporting process. Have there been any fines in the last few months or any enforcement action taken as a result of reporting in the incident?
I couldn't speak directly to what enforcement action has been taken on behalf of, say, the RNC or the RCMP. I would direct you to them. I am aware that Service NL have issued stop work orders. Again, I'm not sure of the numbers. And again, with the Liquor Corporation, I would suggest that you refer those questions to them for actual numbers and details. So that's the best I can give you from my position at the moment, Peter.
Dr. Fitzgerald, I want to give you, I was wondering if you could give an assessment of the 3 sort of small clusters that we've seen over the last few weeks. We haven't seen any new cases connected with them in the last little while. Do you consider them now contained? What's the status and what's your assessment of them right now?
So we're still following up. You know, it's we haven't. Some people in Grand Bank have gotten through their isolation periods, but not everyone has, and so we're still following up. And same for Deer Lake. Still, you know, we're still only about halfway through that. So we're watching things closely. We may see, you know, people may develop, anyone who was a close contact may go on to develop some symptoms. So that's certainly something we're watching out for. But by and large, we feel like things have been, you know, we know what's happening there, and we feel comfortable with where we are right now.
Thank you.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. Today, the CDC in the United States suggested that quarantine periods can be shortened to 10 days with no symptoms or 7 days with a negative test and no symptoms. Is it possible that a similar quarantine period may be introduced in this province?
So certainly haven't had a chance to look at any of that information or the science that supports it at this point. But, you know, we've said from the beginning, if new evidence becomes available and that evidence is credible and reliable and reproducible, then certainly we would, you know, take that into account when considering our recommendations.
Thank you. And back in September, when schools reopened, it was recommended that a lot of older schools keep their windows open for better ventilation purposes. We're at a point in the year now where the temperatures are dropping, and that isn't always possible. So I think it bears revisiting. What are the expectations on schools, and what can they do ventilation-wise when open windows aren't an option?
So, I mean, you're asking questions that may take a little more expertise in the area of ventilation and HVAC than I have, but certainly we would encourage anyone to you know, to be looking at those questions and trying to determine what are the best options for each of the schools. But it's also a very individual thing depending on the schools. But as much as possible, we still encourage schools to keep the windows open and let the, have that natural ventilation. But, realizing that it may not always be possible.
Thank you.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Hi. My questions are related to gatherings. There still seems to be a lot of confusion or a lot of discussion over maybe not following these rules as you bring up. Could you just clarify for people, when does the 50 or 100 person rule apply under sort of the rules for alert level 2, and when do the rules related to holiday gatherings of 20 people apply?
So certainly with the 100, we've made that clear in the SMO that applies to situations where the gathering is being organized by a business or entity that is, able to do that organization, where they can take responsibility for ensuring that the rules are followed and to also take responsibility to deal with any situations where the rules are not being followed. So the 50 is meant to apply to those more informal gatherings that we might have, outdoor barbecues or something like that. What we're recommending for Christmas is that everybody think about 20 when they're thinking about, their contacts over Christmas, that you have a consistent 20 contacts that your household has that you will be socializing with over the Christmas season. But in addition to that there be no more than 20 people at any gathering that you have in your home. If your home can accommodate 20 people. If your home is not able to accommodate 20 people with physical distancing, then you have only as much as your home can accommodate.
And just a little bit more clarity, that when we say Christmas or the holidays and we refer to the rules that we've set to cover the holidays, is there a specific period of time that we're referring to? Is there a couple-week time span? Are we talking about Christmas, the 25th of December specifically? What are we referring to?
So I'm talking about any gatherings that you may be having from now until the Christmas season is over. It's probably not going to be bad advice to follow even into the winter season as people come indoors and we're spending more time indoors. We really need to think about keeping the number of people we have in our houses as low as possible so that we can keep our contacts in general as low as possible.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Premier, in your opening remarks, you noted work with the federal government and the military in terms of vaccine distribution. We now heard from a federal minister that Newfoundland is expected to get its first dose of the vaccine in January. That's just under 4 weeks away. Wondering where we're at in the planning for that vaccine distribution.
Yeah, we've had some good conversations with the federal government, and I spoke with Minister LeBlanc on Sunday at great length about the vaccine and the willingness of the federal government to partner with us on distribution. As we all know, we're not the same as our Atlantic partners when it comes to geography and density, and there certainly is different issues that face Newfoundlanders and Labradorians in terms of distributing this vaccine compared to Prince Edward Island, for example. So they offered, and we've accepted, as previously mentioned, military advice, expertise, and organizational and operational skill sets that we certainly welcome given the geography that we're going to have to distribute this vaccine over. We are working to establish, and again, I said earlier the week that we hope to have a broader announcement with more detail about a vaccine distribution committee, which will have military representation on it, such that we can operationalize a plan and stress test the plan even prior to receiving the vaccines to look for areas of weakness, do a pre-mortem on the plan to ensure that it's the most effective, efficient way that we can distribute this vaccine to the most vulnerable first and then to the rest of the population subsequently.
Thank you. And Dr. Fitzgerald or Minister Haggie, actually anyone can answer this. In terms of the travel forms that went live yesterday and the number of applicants since, We've had several travelers that have come in that have said that they had exemptions prior, had to refill out forms once they arrived at the airport. Can you walk us through the process of how this works once you enter the airport? I guess with the flow of everyone coming in, the breakdown?
From the point of view of the process of someone arriving, when assuming someone has applied for and got their reference number entirely through the online process, then simply that reference number will be presented to whoever's on that border point or entry point there. So it could be FLR at the ferry or one of the Garda World or such at the point of entry in, say, St. John's, somewhere like that. In terms of applying for the exemption, if that's what it is, you're not just a returning Newfoundlander or Labradorian who's ordinarily resident here, you would actually have to go through the categories there of the exemption, pick one that's appropriate for you, and similarly, if you're an essential worker or a rotational worker, then you would actually have to pick one of those categories, and there will be documentation that you will have to bring with you to show, for example, from your employer that you are actually what you say you are in the sense of a rotational worker. So with the reference number and with any supporting documentation that's required, you will then gain entry. If you're a Newfoundland and Labrador resident, you simply need the two pieces of documentation that we've referenced before. All we've done with this form is combine it into a one-stop shop. We haven't changed any of the criteria that were existing last week, and this is just a one place you can go to get your paperwork sorted out. The reference number is for ease, and it allows electronic searching if need be.
Thank you.
Our next questions are from David Marr with the Telegram. Please go ahead.
Thank you very much. I'm wondering, I guess we're approaching Monday, which I guess we could see a decision on rejoining the Atlantic bubble. I don't want to get too far ahead of things, but I'm wondering if the decision to re-enter the bubble, would that be more so based on the situation in this province or based on the numbers, in the maritime provinces?
Thanks, David. As we've suggested in previously, it's not a 1 + 2 is 3 kind of scenario. We weigh many variables and weight them accordingly. But I mean, most important for us is to look at other jurisdictions and see how they're doing, and of course reevaluate where we are in the pandemic, and all of those things will come into the decision matrix about whether to proceed with as we are or re-entering the bubble. But of course, that decision is yet to be made.
Thank you very much. And Minister Haggie, you had referenced, environmental health officers at liquor, liquor enforcement officers going to license, or potentially going to licensed establishments to kind of, ensure the rules are being followed. Is there any similar kind of reporting mechanism for, for private parties that, you mentioned some concern there? Is there any way that people can check in on their neighbors, so to speak?
The mechanism there is through the complaints form. If someone feels that there is an infringement or a problem there, that is a slightly slower process by its very nature. We don't have anyone other than law enforcement who would be able to respond like that on the call, as it were. Law enforcement have been very keen to stipulate at the beginning that this was not going to be something they would regard as a 911 call. And so the onus is on individuals. It's about individual responsibility. And similarly, should the complaint be substantiated, then law enforcement have a range of options which will deliver on that individual responsibility and its consequences. How they choose to do that, that is an issue for law enforcement. Government has never and would never tell the RNC or the RCMP how they should enforce the law. That is not our role.
Thank you very much.
Our next questions are from Peter Cowan with CBC. Please go ahead.
You mentioned, Premier, some of the logistics around committee and stress testing. How confident are you that if vaccines start rolling early in January, we will have everything we need so that there aren't any delays in terms of getting those into the arms of Newfoundlanders and Labradorians?
I'm fairly confident, very confident in the team that Dr. Fitzgerald and her public health officials have been working hard on the back end of developing a plan, and now we're at the stage of operationalizing that, of course, with guidance from federal health officials, and that's why we want to kind of bring in recognizing the unique distribution of peoples throughout our province to ensure that the military are adding their layer of expertise on operationalizing this. And I think I'm very confident that once we get the vaccine, that we'll be able to roll this out in a triaged, responsible, effective, and efficient manner.
We've moved motor vehicle tests online. We've got the new forms available online. Why aren't we booking COVID tests online? Right now it takes 3 different phone calls in order to book one test.
That is an operational issue. For sure, part of the issue is around appropriateness. So we advise using 811 to resolve that problem. To be honest, this is about as much staged rollout of scheduling software. This was untried and untested in this province up until COVID. We did have a pilot in Eastern Health, the success of which was not clear. I'm very impressed with the way the flu shot software rolled out and its lack of issue. And similarly yesterday with the electronic form. The next piece is to integrate online booking with 811. What we need to do, however, is there is a several stage process between 811, the individual concerned, and public health before that test is then organised. We've had Lean look at the form, and I think you've seen the benefits of us doing that with the successes we've seen already. So our next stage is to introduce that Lean process to examine how best to do that. So it's certainly on our radar. It's something we'd really like to be doing, but we had to start somewhere, and we thought this was, if it didn't work, this produced less disruption than trying to get people with symptoms tested when a system wasn't proven.
Thanks.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Cases have risen to levels not seen since the spring in recent weeks. And you mentioned we have 30 active cases in the province now. How are we doing in terms of the strain on healthcare workers, in particular in terms of overtime and time off?
We have, from the RHA perspectives, the bulk of the work here has been around public health, CDC nurses, and public health laboratory. The system behind that, in terms of emergency rooms and inpatient admissions, has not been impacted in the same way. The moment, the RHAs tell me that the resources they have are more than able to match the demand that's been placed on them of late.
Thank you. And in terms of the vaccine, and that's on the horizon, when that does get approved, there will be a need to have doctors ready and physicians ready to administer it fairly quickly with the turnaround. Are we anticipating having to give those physicians or anyone giving out the vaccine any special training related to that? And if so, how do we plan to roll that out?
It's all a part and parcel of the vaccine plan that Dr. Fitzgerald and her team are building. Of course, we have a robust vaccination distribution system here already in the province with well-trained healthcare professionals who can distribute vaccines, as we've seen with influenza and other vaccination programs. So we'll build on that and operationalize it accordingly, given the demand and the supply, in order to meet that demand. But I don't know if you want to comment any further, Dr. Fitzgerald.
Sure. I think we need to also consider that how we're getting this vaccine is not going to be how we've gotten, for example, flu vaccine, where we get quite a large amount all at one time, and we're trying to turn that around very quickly. We will be getting this vaccine fairly slowly at first, and so in the beginning, I think a lot of the vaccine will be able to be distributed through our normal channels and administered through our normal channels that we normally do. So public health, and so we're I guess I want to temper people's expectations of what's going to happen when we get a vaccine. Like it's going to be slow in the beginning, and we'll get more doses as the months go on throughout the year. But it won't be sort of what we see traditionally, like with the flu vaccine, where we get a lot of vaccine all at once.
For sure, and I think it's also worth kind of noting that there's nothing in particular. There's not extra training for a lot of the people that we have already qualified to do vaccinations in order to give. There's nothing in particular to this vaccine so far that we're aware of that would require extra training. So we do have a solid a group of individuals, hardworking individuals who are able to complete this vaccine once it's available. But again, to reiterate Dr. Fitzgerald's comments, this will be slow, and then we'll scale up over time.
Thank you.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Hi. Monday will be 14 days since you announced Newfoundland Labrador would leave the Atlantic bubble. Will we have an update on possible re-entry to the bubble on Monday?
Yes.
Okay. And I'd like to ask a question about testing capacity. In PEI, we had a situation recently where that province tested 1,100 people in one 24-hour period when a student tested positive. What's our capacity right now? What's the maximum amount of tests that the province could perform in one day at the moment?
Currently 2,500. By March of next year, we'll add another at least 800 a day. That doesn't take account of the rapid test kits, which are nearly through validation, the first group of them that we have, and there'll be some training for some of those kits before they can be distributed into hotspots or rural and remote communities. So our baseline that we can rely on at the moment is around 2,500 a day.
Thank you.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. My question is for the Premier. Looking at the federal fiscal update, will the province qualify for the changes to the fiscal stabilization program?
We're still working through the fall fiscal update. I'm hoping that the changes that were suggested will put us in a better fiscal situation. Certainly there was some encouraging news with respect to the fiscal stabilization formula, and I'm hopeful that will provide us with further revenues for the tough situation the Treasury is currently in.
On December 10th, there will be the first ministers' meeting. What issues are you hoping to raise in that meeting?
Well, the December 10th First Ministers' meeting is largely based on the Canada Health transfers, and that I suspect will occupy the lion's share of the meeting and the agenda. And in addition to that, I'm assuming we'll talk about vaccines and COVID-19 in general and the stress and strain it's applying to healthcare systems across the country. I want to assure everybody that my role and responsibility is primary to the people of Newfoundland and Labrador, and I'll ensure that our health voice is well represented at that health transfer payment table. As right now it's up for renegotiation, and collectively the premiers have put forward a proposal, and I look forward to having a healthy, robust discussion with the federal government in terms of how we best exercise responsible spending for Newfoundlanders and Labradorians in accessing further Canada Health transfer payments.
Thank you.
Our next questions are from David Marr with The Telegram. Please go ahead.
Thank you very much. Earlier today, Nova Scotia announced some additional back-to-school funding from the federal government. I believe it was about $14 million. I'm wondering, is this province expecting any additional funds when it comes to the school front?
Sorry, David, I missed the school funds. Is that what you just suggested?
Yeah. Earlier today, Nova Scotia got some additional funding for the back-to-school, for the safe reentry. I'm wondering if this province is also expecting to get some additional funds.
I'm not aware of Nova Scotia's announcement. I can certainly look into it a bit further. I'm not sure if that's outside the school funding that was announced previously in the year or not. If not, I'll certainly have an answer for you on Friday.
Thank you very much. You mentioned about we could start to see vaccine coming into the province in January, and the slow rollout of that for the rest of the population. I'm wondering, based on that, is there any particular threshold of amount of people that would need to have vaccine in their arm before we could transition from alert level 2 to alert level 1 in this province?
Again, that's a complex kind of decision. That's not as simple as one metric. I mean, that will involve a variety of different variables, including the notion that we've talked about and Dr. Fitzgerald can expand on, not just absolute numbers, but non-epidemiological linked transmission or the so-called community spread, what numbers we're seeing across the province, what numbers are being balanced against vaccines. So it's not as simple, again, as having a threshold that is one simple numeric metric.
Thank you.
I will now go back through each reporter to see if there are any final questions. We ask for just one question for this round. First up is Peter Count with CBC. Do you have a final question?
I'm good, thanks.
Thank you. Richard Duggan with VOCM. Do you have a final question?
Yeah, just one. I was wondering if we can get an update on the numbers for how many exemptions have been granted to date.
I can get that for you. Excuse me, I don't have that to hand, but that should be fairly straightforward. We'll email that to you later.
Thank you.
Patrick Butler with Radio Canada. Do you have a final question?
No, that's fine. Thank you.
Kellyanne Roberts, NTV. Do you have a final question?
I do, yes. And it's in regards to a question yesterday or on Monday as a follow. With the government's work from home policies, it's at the discretion of the department head or the statutory office. There's no government-wide policy, and there's a lot of discrepancy between offices and their work from home policy as well as department to department. Is government looking at making a clear government policy on its work from home stance?
Dr. Haggie?
Excuse me. I need a drink of water. The issue of safe work for our government employees and from within my own department is certainly one we've been discussing with HRS. From our standpoint, we would like to try and see as many people working from home as is reasonable, given the circumstances. Obviously, with the increasing cases and the holiday season coming, there is concern about having a lot of people in public buildings. I think the important thing is, and the more nuanced approach, is how you maintain those forward-facing services in our own department, such as MCP and those kind of things, where there has to be some element of face-to-face interaction, and it can't all be done virtually. So those discussions are ongoing at the moment between my staff, the Human Resource Secretariat as the kind of policy maker for government employees, and also the clerk to the Executive Council, who is the province's lead civil servant. So watch this space.
Thank you.
David Marr with the Telegram. Do you have a final question?
I'm good. Thank you very much.
Thank you. And thank you, everyone. Premier, do you have any final comments for today?
Well, thank you all for joining again today. I know these are uncertain times and there is a lot of anxiety continued in our communities across the province. And as the holiday season approaches, I know that those anxieties are going to increase. So I ask you to please look after yourselves. And if you need help, please reach out. You're not in this alone. There are plenty of avenues and vehicles available to you to seek help. And please, if you know someone who you think even needs help, please reach out to them. It's incumbent upon all of us to look after ourselves, but also each other during these trying times. So thank you, and we'll stay tuned. We'll see you on Friday.
Thank you, Premier. Take care, everyone. Stay safe and enjoy the rest of your day.
Our smartphones. We use them to keep in touch, to play, and to work. Now, your smartphone can help you limit the spread of COVID-19. Someone can have COVID-19 and not know it. They can spread the disease before they have any symptoms. The Government of Canada has developed an app that will let you know if you may have been in contact with someone who has tested positive for COVID-19. The Covet Alert App creates a random code so that no one will know your name or your location. The app uses Bluetooth to exchange random codes with nearby phones. The code is a randomly generated string of digits and letters that changes every 5 minutes, so it cannot be used to identify you. The app does not have access to your name or address, or your phone's contacts, your location, or your health information. If someone you've encountered later tests positive for COVID-19 and uploads to the app a one-time key they received from their healthcare authority, you'll be notified that you may have been exposed. If you test positive for COVID-19, you can upload your one-time key from your healthcare authority. The app will then notify the people you've encountered without revealing your identity. You can then take steps to limit the spread of the disease. If you know you've been exposed, you should contact your local public health authority and follow their instructions. Using the app is one more thing we can all do to help limit the spread of COVID-19, in addition to washing our hands, keeping 2 meters apart, and wearing a non-medical mask or face covering when it's difficult to maintain physical distancing. You can do your part by downloading the app today and helping others use it too. The more people who use the app, the better we can contain COVID-19. Help protect yourself and your community. Download the Covet Alert app to help limit the spread of COVID-19.